Good morning, everyone, and welcome to my presentation on traffic and ambulance collisions and EMS practice. As we can see here, my name is Edward Denton. I am an EMT, nationally registered, and I'm an occupational health specialist with the NHTSA. Welcome here at Metro Ambulance. I hope you learn a bit from this presentation and can kind of change your practice to keep everyone safe, both you and your patients.
Well, we're going to start off here by just giving a general overview of what the presentation is going to be about today. So as you can see here by the slide, we're going to have three kind of main parts about the presentation. The first part is we're going to ask the question, what are the risks? But in addition to what are the risks, why should we care? We're, of course, very busy people, not getting much sleep, especially in this pandemic, and have long shifts with minimal time outside of that. Why is this important? And we're going to kind of do this by going over the statistics that we have about how often do these kind of incidents occur with ambulances and traffic, as well as personal injuries within that, and kind of what the mortality as well of these incidents when they happen. We're also going to look at some fun pictures of ambulance crashes because we are an EMS, of course, we gotta look at those groups of pictures. But I kind of just want you to see real world about the effects they can have on the lives of EMS providers as well as patients. So we're going to kind of move on to what our second part is. So I'm going to give you all this information, these statistics, and initially they can be a little scary. And I don't want to just kind of leave you in the dark and have you scared to ever enter a car again. That's not my intention. So I'm going to kind of give you what the current recommendations are, some safety tips to kind of best prevent any injuries from happening. Because prevention is, of course, our best option. Stop the injury or the accident from happening in the first place, and how we can set up everything for success instead of failure. But of course, we can prepare all we want, we can do our best in this prevention, but accidents always occur. They're inevitable, but we can kind of mitigate that risk. But in the event that they occur, I'm also going to give you some what are recommended advice. Protocols can vary not only by state, but by your specific EMS agency, but these are some kind of guidelines we can follow, such as placement of the ambulance in a traffic collision, as well as some things you can do inside, such as securing all the equipment, and what we can do to not only keep ourselves safe and mitigate that danger, but as well as our patients. And then our third part of our presentation today, we're going to go over a case study analysis. And as it says here, a practical application of what we learned in the field. Of course, I can give you all these books and stuff, but how can we actually implement it in our day-to-day life? So we're going to look at a call from dispatch all the way to returning back to base, and kind of what small changes we can make throughout the entire process, which can have big implications in the future.
So we're going to begin now by discussing what exactly are the traffic dangers. As EMTs and paramedics, of course, we're familiar with a lot of different traffic injuries if that's what we respond to, but I just kind of wanted to touch over a bit of the different injuries which could occur, as well as the types of incidents which can happen. So first, looking at our little figure on the left, we have first herniations, of course, that can cause lower back pain and can be chronic throughout the rest of your life if it's not treated in the event of a car accident, including ambulance accidents. Also, shoulder injuries and more musculoskeletal injuries similar to the knee injuries, as well as fractured bones, which they can be minor, from hairline fractures all the way up to major femur fractures, and can at times be life-threatening. Another major type of injury are head injuries, traumatic brain injuries, concussions, as well as possibilities for intracranial hemorrhaging. Of course, that can cause long-term memory issues as well as immediate effects and can be life-threatening. One of the possible side effects, which is not often discussed, is post-traumatic stress disorder. Personally, I know of quite a few people who, after a severe car accident, cannot drive because of the trauma associated with that. And of course, you would want to seek treatment in the event of any of these injuries, and of course, go to the hospital in the case of an accident, just to make sure everything's all right and you're not kind of living with some unidentified injury. Of course, ambulances are, in their simplicity, just a really big truck, so of course they're prone to all of the accidents of regular cars. such as vehicle rollovers, which we can see in the right figure. Side impact collisions are very common. T-bones would be included in this. Head-on collisions, they are some of the worst types of collisions. And then rear-end collisions, both with the ambulance being the one hitting the other car, as well as being hit from behind. Now we're going to just play a quick game of true and false, because we all think, of course, this will never happen to us. So I want to kind of see how much you actually think you're susceptible to it, and if those are accurate kind of beliefs. So most ambulance crashes happen during inclement weather affecting visibility. This is actually incorrect. Most of the time, it's a bright sunny day, a normal day, and that's when accidents occur most often. So our next is number two. Most ambulance crashes happen at traffic signal devices. These are your stoplights. And yes, it's true. Of course, it makes sense. There are a lot of cars trying to do a lot of different things. It can be a bit confusing, and you can get yourself into an accident. So moving on to the third, at night on roads with poor lighting. This is similar to our first one. It is false. Most of the times it happens during the day when there's good visibility from weather. And then we're going to go to our fourth one, when an ambulance is attempting to pass a vehicle. Yes, I will say this is still a risky maneuver, but it is actually not the major cause of ambulance crashes. And number five, when at an intersection as well as during turns. This is true. So this is actually the leading cause of ambulance crashes is when you're kind of trying to make, especially left turns, and you kind of get hit by another car in those intersections. That's why those intersections can be so dangerous. And number six, on dry roads. Of course, you think, oh, they're going to happen when it's rainy, when it's wet, when it's snowing out. Same as that weather affecting visibility. But again, on dry roads, they are most common during that time, of course, because the roads are dry most of the time. But we just want to be aware that these can happen at any time on days and conditions which you don't necessarily expect. As evidence-based providers, because I know we're practicing some evidence-based medicine out there, we kind of want to know, what does the data look like? Does research support these kind of ideas? Do they go against it? And like, what are the risks from a statistical and epidemiological perspective? So I kind of have some data here from the NHTSA. It is a bit dated from 1992 to 2011 is when the data was collected, but of course it's still relevant today as not much has changed in kind of the behavioral patterns as well as the types of ambulances used. So of course we're going to start with, in general, this is an average taken over the span of years. 4,500 crashes involving ambulances occurred each year, again on average. And kind of among those 4,500 crashes, about 1,500 of those will be injury crashes without fatalities, and about 29 will have a fatality. But then we look at the numbers below that. Every ambulance crash is not just going to have one injury, one fatality. That's why there are 2,600 injured persons on average in a given year, as well as 33 fatalities. So we kind of want to look a bit deeper and see, hey, who is most at risk here? So as we can see, in both groups, it's most often the occupant of the other vehicle. Ambulance safety standards, while there actually is not a whole lot of regulation, is well done because, again, you are protected by this large truck, assuming that you are secured and everything in the ambulance is secured. And the ambulance driver is often more protected because they, again, are seated in an actual chair with a seatbelt and not moving around trying to kind of care for a patient. And then something of interest is our last kind of line here is that the majority of incidents are during emergency use, both for injuries as well as fatalities. Um, Often we use these lights and sirens to kind of let people know we're coming, but it kind of gives us a false sense of security, which we'll talk about later. So of course we want to be aware, even when we're using lights and sirens, that other cars are around, other things can happen. Of course, we're always at danger and we want to kind of mitigate that. So again, as I mentioned earlier, I don't want to kind of give you these statistics, give you these dangers, and kind of make you scared to ever go back on the road again. I want to give you some recommendations, some tips, and things we can actually do to kind of keep ourselves safe from both a driver and a passenger perspective. We're going to start by focusing on some driver recommendations. So of course, you want to be aware when we're driving an ambulance. Of course, we have a lot of space. We have to use our mirrors quite effectively. And we kind of want to practice these core values of defensive driving, such as covering the brake if you're kind of going into an intersection where you are slowing down and not necessarily on the gas, you want to be covering that brake. And just be aware of not only your time that it takes to stop your ambulance, but the stopping time of other vehicles and where we kind of want to position ourselves, right? We also want to be assured that we're being aware of our speed and possibly implementing electronic driver monitoring feedback systems. Often these are called black boxes, and they can kind of tell your boss if you're speeding a bit too much. But speed is not always the best. You want to do it safely, and while it may be best to get the patient there as soon as possible, a few minutes, often in most cases, isn't going to make that big of a difference. Again, you also want to be familiar of your service area and road conditions. Know where you're working, know what roads are, kind of know how tight they are. Yes, we can use these GPS type systems, but we want a general idea of what's out there. Also, kind of listen to the news when you kind of start your shift if you have time. Know about closed roads, any major construction. We also want to perform regular rig checks or where we check our ambulance. Often we focus on our equipment in the back, but we want to check the actual ambulance, check the engine, make sure it's functioning, make sure proper maintenance has been done. All right, and then our kind of last thing is with lights and sirens. As an emergency vehicle, we have these lights and sirens as a tool, but it may not always be best to use them. Often, lights and sirens can actually cause, as mentioned earlier, you to be a little bit more relaxed and assume everyone's kind of get out of the way. This is not always the case. And while certain jurisdictions and some agencies require you to always be on code 3 with full lights and sirens, if that's not the case, we want to kind of be considerate and not always just be like, hey, we have a patient in the back, let's do this. As it kind of can make us more aware and can at times disturb the patient, the lights and sirens too. And that's one of the considerations we want to have. Next, we're going to quickly talk about some passenger safety recommendations. A lot of us as EMS providers aren't always driving, especially if you're a more advanced life support type provider like a paramedic or an AEMT. You're going to be in the back a lot. But we also have some safety recommendations for you. So we kind of want to start off with what we call the three S's, and that's going to kind of remember what to secure. S's stand for secure. So of course, want to start secure your patient. We have this lovely photo on the right that can show you these. We want to put all full restraints. Notice how we have the harness here on the right as well as the waistband. Oftentimes there's another clip on the top along the chest. We want to include that. And of course, secure the legs and make sure the actual stretcher is secured firmly and appropriately to the ambulance itself. We also want to secure our equipment. Notice how here the cardiac monitor is secured, all of the oxygen tanking is secured in the back, all of the additional medical equipment is secured, as well as communication equipment. We don't want those flying around in the case of either a lot of traffic, your driver's not the best in a lot of cases, or in the case of an incident, we don't want those possibly hitting the patient, hitting yourself, and causing more trauma. And of course, we want to secure ourselves. This kind of will remind us that, hey, yeah, we're trying to care for this patient, but we got to keep ourselves safe. Remember, BSI Team Safety, we always teach that as a priority in our EMS education. And notice how in this picture we have the provider sitting in the captain's seat with a full, what's it called, seat belt on themselves, keeping themselves safe while also being able to provide care for the patient, ventilating them. Of course, we need to move around, we need to move an IV, we need to do something else. That can happen, and we want to, of course, remember, do what we need to do, but also keep ourselves safe. So if you move to the side, put that seatbelt back on, keep it on, and continue what you're doing with the patient. So of course, this moves on to our thing that we have next is remain seated unless absolutely necessary to move. And one kind of tip is to consider treatment such as IVs that are on the side or something like that. Prior to transport, of course, we're going to have emergent patients kind of get them out, but if we can do it on site, it's a bit safer. And of course, if there ever is an accident, call 911 as soon as possible. You want to get yourself taken care of for the patient, your driver, as well as anyone else who may be in the ambulance. One of the topics I wanted to discuss quickly was pediatric considerations, as it is not often thought of that we have all these devices which we can use. I just want to talk about some recommendations from the NHTSA. So first, you're going to require that additional safety devices are used when being transported, and these are available for stretchers as well as any additional seating like the side benches and the captain's chair. And if your patient is not the pediatric child, you probably want them to be in the captain's chair as it is the safest position for them. We kind of have a picture here along the bottom, which is an example of some of the restraint devices we have for children just to keep them safe, all the way from brand new infants all the way to some older children. I wanted to end our presentation today with a case study as it'll allow us to give practical application of the things we learned today. And we're going to talk about a team working with Bell Ambulance in Milwaukee, Wisconsin. So I'll give you a quick sec where you can pause the video and read the slide while thinking about yourself in this position. All right, I'm assuming you read that and kind of are thinking about different aspects of it on your own. We're going to kind of talk about what some of the key points that I wanted you to notice here. So this was a rollover. So it'll make us think, of course, it's very important that things are secured. Again, we're looking at securing the patient, our equipment, as well as ourselves. And in this event, lights and sirens were used, and it was, of course, at an intersection. These are, again, make it more likely that an incident will occur. We want to keep in mind, should we be using lights and sirens? Is it a critical patient? And during intersections, we want to be especially careful when making turns, as it's often not the actual driver of the ambulance which is at fault or causes the accident, but again, like in this case, it was another car that happens to hit the ambulance, which caused the rollover, injuring a third car. Again, this is just one scenario, and we want you to kind of make these considerations and critical thinking whenever you are transporting a patient in the back with the patient, or you are the actual driver of the ambulance.